Shown this slide a couple times, but just to remember that this is already occurring. And what do I mean by that? We do have a lot of reports of either accidental ingestion, knowing animals that can get into pretty much anything. And as we, as a society, grow to have further access to psychedelics, it's a good chance that there'll be increased access for our pets as well. It's accidental, as we just mentioned, intentional dosing. And so by this, I mean, typically people who've had psychedelic experiences themselves, and then want to either share that or for some perceived for wellness or support, want to either microdose or give a larger dose of psychedelics to their animals. And then we have malicious as well, where there's no therapeutic kind of mindset or hope of providing support and just giving animals doses of psychedelics. And so these are different, and I think we will have to approach those differently as a profession. And last year, ASPCA released their top 10 toxins, and recreational drugs being number 10, but it's rising, it's growing. This group has done a really good job overall. This is kind of a classing of psychedelic or hallucinogenic drugs with other recreational drugs, so including some opioids, cocaine, PCP, things that I wouldn't be considered psychedelic or therapeutic, as we're talking about them in maybe more in that slant. But it does have really good information. So I recommend both this one and a lot of the information that the ASPCA has put out as really, really good baseline information. So this, again, this ASPCA, they have a really good kind of summary of a lot of different illicit drug intoxications. So again, I do recommend having a read through that and as we go into further discussion. And again, this is very much human data, but it lists the comparison of people seeking medical treatment when taking a certain substance. And interesting enough, so psilocybin or magic mushrooms being one of the lowest, very few reports of people going to the emergency room for this. Cannabis a little bit higher, LSD above that, and then we get into kind of some of the more illicit, or I'm going to say harder drugs, cocaine, amphetamines, and then we have MDMA and ecstasy up there. I want to focus on today. So psilocybin, being magic mushrooms, the one that we've seen might be the most common for ingestion, and some of the kind of added concerns I think I have here are wild mushrooms in general. And so either people foraging for thinking it's psilocybin can actually be mistaken for much more toxic mushrooms. And so is it actually what we think it is? So that's something to keep into mind. People might be grouping or categorizing psilocybin mushrooms or magic mushrooms, amanita as well, as we discussed last week in that recall dosing from the diamond shrooms, which is still ongoing and seems to be still on the shelf in many places. So please be careful. That advertised as amanita was actually psilocybin. So there could be vice versa of that. And for me, in what I know, but I think it's not one that I'm greatly knowledgeable about in terms of amanita, that it can have kind of a lower threshold or a lower window of toxicity. And so I think the dose here is going to be very important. And there have been fatal reports of dogs eating amanita, and I believe in people as well. And so one that can be a little bit more caution, the preparation of it, the dosing needs much more careful oversight than I think psilocybin, right? Psilocybin, I think, has a large dosing window. There's human reports of people taking over 100 grams. They work up to that, and remembering 5 grams is a kind of a threshold dose or a psychedelic dose. And so these very, very large doses, and we're also hearing reports of anecdotal reports of people of people's pets getting into fairly high doses of psilocybin and being okay. So not to diminish the potential very uncomfortable trip that animal might go through, and still would recommend monitoring and supported dosing. And again, if it's an accidental ingestion and no clinical signs, then emesis and plus or minus charcoal to ensure that animal is not uncomfortable. Again, this kind of bringing in chocolate and xylitol. So both of these substances are commonly found in these new preparations of chocolate mushrooms, cannabis, what have you. And knowing that there's a sensitivity to chocolate and xylitol in all your patients that could be fatal just on their own. And so an added thing that I think as a veterinary profession we need to be aware of. Psilocybin in general, you're looking at kind of a 2 or 6 hour window of effect. So even if the animal does have a psychedelic dose, it should be within that window, and would recommend monitoring for that time until you saw they were stable again. So going back, let's say we're not having an absolute crisis, or we're not suspecting serotonin syndrome. We're suspecting, let's give an example of the patient got into several grams of psilocybin mushrooms, appears normal, but we do see a psychedelic effect that is pretty profound. And so the patient's already several hours into this. How do we treat it? And so what's a specific way to monitor a psychedelic patient in this framework? I think IV fluids, venous access would always be safest. Remembering to minimize stimulation overall, dim lighting, even calm music, and then keeping them nice and warm or thermoregulated. Vital monitoring, heart rate, respiratory rate, SpO2, blood pressure. I put this, but I also wonder, right? I wonder about the discussion, and really excited for input of being too hands-on versus hands-off, right? And I can only take this from kind of a human-centric point of view, being handled in that specific state, bright lights, things like this, poking, anything you're going to be, could just make things worse for that patient. So it's really going to come down to clinical judgment and what you think is appropriate. And of course, how much you trust the knowledge that you received either from the owner. But I think it's something for us to discuss and consider. And so I actually consider or think about this in kind of a pre or post anesthesia care, and that it's not much different for me overall. Especially, let's talk more about the kind of post-operative care or anesthesia assessment. And I take this from, if you can see it, so this is from some RAVs, so a wonderful group, and I use this with their permission, of their beautiful chart that they've laid out of assessing anesthetic depth from stage 1 to stage 4. Stage 1, just kind of a quick recap, being kind of a pre-anesthesia phase, or we're not going to see too much changes, but and the patient's not out completely. But there might be some changes in vital signs, maybe their pupils change, things like this, and then going into a stage 2, that excitatory phase, or I'm going to say dysphoric type of phase, which we also may be able to see in the psychedelic phase, and then getting into kind of anesthetized phase. I would think we're going to be more in stage 1, stage 2, maybe a light anesthesia phase, or might mimic kind of a light anesthesia phase if they're pretty out of it. But they should still be responsive to stimuli. Anything beyond that, yeah, that would get a little bit scary. I would think of more contamination, or if we're talking super high doses in some of these patients. So I think this is a good chart for us to refer to. And let's say we have our patient, we're monitoring it. Can we use these kind of charts to start to classify, to start to get an idea of what are the psychedelic effects and relate them to what we already know and are comfortable with? And so that's how I we'll sometimes approach these cases depending on the situation. Okay. And then what about follow-up care in general? Let's say your patients have done well, you either decontaminated them or not, depending on the situation. They've recovered well, they're going home, we're all happy. But what about long-term or follow-up care? And so I think this is where it gets kind of more interesting, and this is what we'll go to in the next discussion group in a couple of weeks, because we think it's really important. We're knowing that these psychedelic experiences can reopen critical periods in these patients, and depending on the substance, depending on the amount, that could be weeks to months. And so us having a better understanding of this, I think, will help us also approach our clients to be able to say, yeah, this happened now, but we're not quite sure what's going to happen over the next 2 or 3 weeks. It could be, in some cases, a great opportunity to find new behaviors. If there's any kind of inappropriate behaviors or difficult, challenging behaviors within that patient, maybe that's a great opportunity to work with a trainer or behaviorist in that situation. Or are there negative consequences of this that we're seeing within those follow-up periods as well? We don't really know. And so I think this is a good starting point for us to at least have the discussion. And then I'll post more on not this Monday, the following Monday before the next group, and we'll go a little bit more into what this actually means. What is this critical period, and start to discuss how is that going to potentially show up for us as animal health professionals. Good. That's all I have for today. And feel free to reach out if there's any questions that you want to bring up outside of this or any concerns. Please let me know. I'm always happy to chat about that.